So what motivates me to get up every single day is being able to go and engage with all of our staff and the people that we serve in our community who want to make a difference and who want to feel better. I am driven by a purpose of well-being for all, and I get to have a small part of that every single day in the work that I do. Such a privilege.
Rory, can you tell us a little bit about your connection to Polara Health and like the history there and what?
Yeah. So my connection to Polara Health started almost 12 years ago. 12 years ago, in 4 months, my father died by suicide. And I spent that entire summer going into the fall in a really bad place. Not because my dad was dead, but because I realized when he died that I had mental health issues that I wasn't addressing and hadn't addressed. And I was already 24 and I've been doing this for 20 years and not really sustainable, as evidenced by him dying. And yesterday would have been his 56th birthday. And, you know, I never thought out to honor him, but I definitely thought out to remember him and to teach him to myself as a lesson of like, okay, I have to put in the work. It's not my fault. I had my childhood. It's not my fault. I had my trauma, but I have to put in the work. I just didn't feel empowered to do that. I didn't have resources. I was unhomed again and stayed with a friend. And I had a really bad day and the suicidal and got taken to Winsong, the old hospital location. And that was October 12 years ago now. And I've been a client. It was a couple of false starts just because I didn't know how to engage in care, but I've been a client consistently for 11 years. In that time, I've learned skills that let me keep my family happy and safe, that keep me happy and safe, and manage my medications and symptoms. But also, like, I'm able to help people now. The thing about being schizophrenic is that people use that as an excuse to deny your agency, right? They use that as an excuse to not let you make choices about your care. I don't have that at Polara, but I've had that other places. And at Polara, if I get that feeling, I tell the person, I'm getting this feeling that you don't want me to make decisions about my care. And they immediately just hands off. They're like, no, that's not what we're doing. I think there's a better way to do it. But let me tell you why I think it's better. I'm not going to force you into this, right? And so, well, I never intended to have a steady care provider that I was going to be with for years. Polara just keeps winning me those points, that staying power, because they show up when I stop going to appointments. Someone calls me when I'm not getting care or I'm in emergencies, or they work at the hospital and somebody checks on me. And I have case managers and a therapist and medication management, all those things that give me that continuity of care that have allowed me to have enough function to actually get on disability, because I was so disabled I couldn't get on disability. And so Polara did that. I mean, the peer support program walked me through how to apply for disability and helped me get a lawyer, and, you know, all kinds of little tiny steps that I just didn't know were possible. But they were like, oh no, here's exactly what you need to do. We know how this works and we know how to help you. And so I just each time.
And Rory, you know, you've had such a journey, but now you give back as a peer.
Yeah, that's
reach
true.
a point in your recovery that you're able to give back in a different way. Can you talk about being a peer and how that's...
Yeah. So I started my work at Polara as a volunteer pre-COVID because our facilitator was ill and wasn't going to be able to facilitate, and they wanted continuity of care for everybody. And so I had just completed my peer support certificate through NASCARE.
Oh, right.
And I offered. I just said, hey, I can help with this for a little while. I don't know everything, but I know enough to get through this unit while they're, recovering. And they said yes. And so, because they prioritized people getting the continuity of care, which was so powerful, like how many clinics would say, yes, community member, client, you can lead the group so that everybody still gets care, because we don't have somebody more qualified than you. And that was really powerful for me. And so I did that for a couple of years. And then partway through COVID, I got my disability approved, and I kind of was starting to get in a more solid place, and I started working for Polara properly. And then I realized that I wanted to do more, and so I started a YouTube channel and a website. And now I have a social media presence, and it's like my work is multifaceted, because that's how I can reach the most people. And that's inspired by the teachers and facilitators at Polara that have taught me those skills.